I'm Dr. David Bernstein. Welcome back to our series, 25 Tips for Working with Modes. Now, last time we talked about how you can create a narrative that helps somebody to understand his life, his life's trajectory, how did his problems arise, what happened to him growing up, how did he get to the place where he is now, and what are the nature of his difficulties. And we talked about the fact that you can use modes as a central concept to help him to understand his life story. And I gave you an example of how you can tell the patient a story that helps him to kind of piece this whole picture together, that can bring some coherence and some clarity about what his modes are and how they developed. Okay, but I didn't tell you sort of how you go about constructing that story. How do you gather the information that you need and weave it together to create a kind of coherent whole. And that's the topic of today's video, Seek It. Now, in Schema Therapy, we usually take the first several sessions to do an assessment, a kind of comprehensive assessment of the person. And we're trying to, among other things, assess their early maladaptive schemas and their modes, and to try to use schemas and modes be able to look for repeating patterns in people's lives, because that's what we're after. What we're trying to do is get some insight into what are the repeating patterns that keep people stuck. And so we usually take a careful life history, we give them questionnaires, like the Young Schema Questionnaire and Schema Mode Inventory. We may use imagery to try to get to the origins of patients' schemas and modes. And as I've emphasized in this course before, we use observation. We try to look at, what are the modes that are present in the here and now? What are the modes that get activated in our therapy sessions with the patients or on the ward? And we also can use the I modes as part of the assessment process. Now, this is something that I've been doing routinely over a number of years now. And it's something that can also add some value when combined with all of these other forms of multimodal assessment. Now, let me give you an example of how this whole process works and how you can then use these various sources in order to get the information that you need to create a coherent narrative of somebody's life. And I'm going to use the example of Ron. Okay, so Ron is a patient who comes to therapy. Here you can see he's being played by an actor. He's in his late 20s and he's having repeated fights with his girlfriend, and it's gotten so bad that he's considering even breaking up with her. Now, if you take a look at this picture here of Ron and you just ask yourself, what do you see here, right? We start with observation. We see a look of, that Ron looks quite somber, right? He, looks quite down. There's a kind of quality of vulnerability about him. And so very likely, he's in a vulnerable child mode. It's maybe in an abandoned child mode or maybe a lonely child mode. And from the first session on, you can actually introduce the I modes, and you can simply hand him the set of cards and ask him to take a look through them and to see if he can find any modes that he recognizes in himself. And in this case, the first card that Ron chose was the detached self-soother mode. Now, that's obviously a very different mode than what he's presenting here in the session. But when asked about it, what Ron said is that he's struggled with substance abuse from the time that he was young, from the time he was in his teens, and that he recognizes that it's, that he uses substances, as a way of numbing his feelings. Okay, now how further? Well, I mentioned that we almost always take a thorough life history in the assessment phase of schema therapy. And in, whether you're working with schemas as your main organizing concept or modes, what you want to be doing is listening for those schemas or modes as you hear somebody's story and asking questions to try to probe to get you the information you need to identify those schemas or modes. Now, I'm going to focus on modes here, and if you're doing this with the I modes, and you've already introduced them to the patient, you can also from time to time, take the mode card that represents each of the modes he's talking about and show it to him in the course of taking this history and ask him if he recognizes these modes. Or you can wait till he's finished taking his history and then go one by one and share with him the modes that you've heard in his story and see if you can get some confirmation from him. So in the case of Ron, he talked about the fact that his parents were divorced when he was 8 years old, that he missed his father terribly, and that was the origin of his abandoned child mode. And what happened was that he was essentially raised by his mother, who was quite needy and quite smothering, and was also very critical of Ron's father, and would even explicitly say to him, don't be like your father. And so on the one hand, he developed a coping mode that tried to comply with his mother's demands, a compliance surrender mode, but at the same time he developed a kind of inner critic side, an internalized parent voice that told him that he was really a bad person, especially if he wasn't being sensitive to other people's feelings. And finally, the atmosphere at home was so enmeshed and so stifling that Ron had to escape, and the way that he did that was by going out with his friends and using drugs and alcohol. Okay, now how further? Once you've assessed the patient's life history and you've identified some of those repeating themes or patterns, either using the concept of schemas or concept of modes, you can then focus in on particular problem areas for the patient. What are typical kinds of situations or scenarios that the person is struggling with? And in Ron's case, the problem that brought him to therapy was his repeating fights with his girlfriend, and they always seemed to follow the same pattern. And so you can talk with him and explore that pattern with him and create a kind of mode sequence. And if you're going to use the I modes, you can literally lay the cards on the table one after another. And the two of you can kind of do this collaboratively to create a sequence that will help him to gain insight into the modes that play a role in these repeating patterns. In his case, it always starts with the fact that he wants to get together with his friends in the evening, and his girlfriend doesn't want him to. And Ron, even though he's been with his girlfriend for 2 years, wants to go out with his friends at least 3 or 4 times a week. And when he announces to his girlfriend that he's going to go out, he sees the hurt look on her face, and he immediately feels angry at her. He feels it's unfair that she is trying to control him. And furthermore, he feels so helpless and frustrated because this pattern has occurred so often that he then lashes out at her. He verbally attacks her and says really mean things to her. And then when he sees the hurt look on her face, he feels terribly guilty. He starts beating up on himself and telling himself, how could he be so insensitive to her? And that, of course, is that punitive parent side, the inner critic voice that we talked about earlier. And then he tries to make it up to her. He tries to comply with her demands. And he says, okay, I won't go out tonight. I'll stay home with you. But that doesn't resolve the problem, because underneath he still feels angry, because he's not getting his needs met. He's deferring his needs to her needs. And so in the end, he ends up in an anger protector mode. Feels angry on the inside. He's not letting it out openly, but is very evident in his behavior, facial expression, nonverbal communication, and that creates distance between the two of them. And over time, this pattern is repeated again and again, and has really had detrimental consequences in their relationship. Okay, so when you piece this picture together, what you see is that the modes that are occurring in this mode sequence are many of the same ones that we heard about already when we did the life history interview, when we explored his origins. And that makes sense, right? That these patterns that developed early on in his close relationships growing up reoccur in his close relationships as an adult. Now, how do you go further from here? Well, there are a number of avenues, but once you've sort of pieced together the kinds of modes that are involved in Ron's life, you can also start to ask questions about what his basic emotional needs are. Because when we're doing schema therapy, ultimately it's about helping people to get their emotional needs met in a more satisfactory way. And when you hear the story of his fights with his girlfriend and his origins, what you see is that there are two competing needs that he has that conflict with each other. And those are the needs for attachment and autonomy. On the other one hand, he has these abandonment issues, and he wants to get close and be close with his girlfriend, but it's a kind of approach avoidance conflict. The moment he starts getting close to her, he wants to escape. And that, of course, represents his need for autonomy, right? His need for freedom, for independence, and so forth. So what we see here, once we have constructed a kind of a picture of Ron's modes, how they developed, how they explain the repeating patterns in his life, then we can look a step further at what those emotional needs are that we want to focus on in treatment. Okay. Now already from this description, you probably have a pretty good idea of how, this picture fits together. But we're going to go further next time, because there is a way of creating kind of visual diagram of Ron's modes called a mode map. And we're going to talk about how do you take this information that we've gleaned from this assessment process and turn this into a visual representation. And that'll be our topic for next time, Map It. And please go to our website, www.imodes.com, and take a look at our image-based therapy tools. Have a great week, and see you next time.